I welcome you all to this session. I will be teaching you more on systematically and efficiently searching the health science literature. In this session, I am going to tell you about underlying theories and overall procedure of exploring the health science literature in an organized and systematic method. Also, I'm going to tell you how important the systematic review of literature is to demonstrate the result of the research. A systematic review is a review of a clearly formulated question that uses systematic and reproducible methods. It is also to identify, select, and critically appraise all relevant research, collect and analyze data from the studies that are included in the review. A systematic review attempts to collate all empirical evidence that fits pre-specified eligibility criteria to answer a specific research question. It uses explicit, systematic methods that are selected to minimize bias, thus providing reliable findings from which conclusions can be drawn and decisions made. Systematic review is a combination of processes: systematic and review. Systematic review is a review of literature in a systematical way, a review that follows a proper available standard. There are various standards available to review the literature. A good systematic review follows a proper and authentic standard. Methodological validity of the review is directly dependent on the output of the systematic review's assumption, so a researcher has to follow an appropriate standard and tools. The most commonly used standard is the Cochrane standard, and it is the widely used standard. The methodological expectations of Cochrane intervention reviews, known as the MECIR standards, are methodological standards to which all Cochrane protocols, reviews, and updates are expected to adhere. These standards are published in Cochrane Handbook for Systematic Reviews of Interventions. Preferred reporting items for systematic reviews and meta-analyses, or PRISMA, is another important standard for systematic review. PRISMA is an evidence-based minimum set of items for reporting in systematic reviews and meta-analyses. PRISMA primarily focuses on the reporting of reviews evaluating the effects of interventions, but can also be used as a basis for reporting systematic reviews with objectives other than evaluating interventions. Another systematic review standard is IOM standard and is published by Institute of Medicine. IOM recommends standards for systematic reviews of the comparative effectiveness of medical or surgical interventions. The standards are meant to assure objective, transparent, and scientifically valid systematic reviews. The Center for Reviews and Dissemination, or CRD, at the University of York specializes in evidence synthesis, assembling and evaluating data from multiple research studies to generate robust evidence to inform health policy and practice. Center for Reviews and Dissemination publishes a standard for systematic reviews called CRD Standard. These standards are available in Guidance Handbook for Center for Reviews and Dissemination. Systematic reviews not only follows the standards, but also tools to measure methodological quality of systematic reviews and quality control. AmStar is one such tool used to measure the methodological quality of systematic reviews. Researchers use various study designs for the research. These designs are chosen based on the nature of the research. The various study designs can be randomized controlled trial, cohort studies, case-controlled studies, case reports, and so on. For a valid scientific outcome, a researcher may adopt any of these study designs. A researcher may use a cohort study model to conduct a cohort study. In normal cases, the approval for a health science research at an organization is approved by the Institutional Review Board. Since systematic review is a systematically conducted scientific study and includes all the evidence of the research topic, such a study may not require a prior approval from the Institution Review Board. Types of systematic review. A systematic review can be either quantitative or qualitative. A quantitative systematic review will include studies that have numerical data. A qualitative systematic review derives data from observation, interviews, or verbal interactions and focuses on the meanings and interpretations of the participants. It will include focus groups, interviews, observations, and diaries. Systematic review requires a thorough literature search. Literature that is published and also literature that is available in gray literature. A researcher has to exhaust all the sources of information related to the particular topic. A good systematic review also involves searching of information not only from the subject sources, but also search in the resources that are interdisciplinary in nature. Like if a researcher is conducting a study on a tuberculosis and living condition in urban areas, then sources related to urban areas and living conditions from subjects like sociology and any others should also be covered. A researcher conducting a systematic review is required to collect every single possible search term for a given concept in a topic, which not only includes controlled vocabulary, such as the medical subject heading MESH, but also regular text words and all of their synonyms. Keywords and other terms denoting the concept should also be used to search for the literature to avoid any chances of missing those terms used in the literature. Controlled vocabularies like MESH or the SYNOL headings play an important role in the literature search. Living knowledge in form of experts in the field also plays an important role in the review. Researchers should consult with the experts. Review should include only authentic studies and exclude works that do not have proper study designs. With such a process, the literature gathered may include evidence that supports the hypothesis of the review or that does not support the hypothesis. Such a systematic search and review will help to gather the complete evidence of the research topic and supports the hypothesis of the study. The type of review the researcher is writing depends on how systematically the search was conducted, how extensively the researcher has searched, and how and what resources the researcher has covered. No matter what type of review you decide to write, having a systematic approach to your literature search will only enhance your research. We have come to the end of this session. We hope this session was helpful for you to understand the systematic review process. If you have any further questions, please contact your librarian.